Digonis, co-founder and CEO of InSyBio, a technology enabler for personalized medicine through the discovery of early-stage biomarkers. If you remember, there was an article recently at Bloomberg in April about the world getting fatter and no one knows how to stop it. Well, actually, that's not true anymore. On June 6th, we had a public announcement together with Nestlé Institute of Health Sciences that we demonstrated the ability to locate proteins, peptides, and spectra to locate the biomarkers which select the best diet for us. Not only this, however, we could also forecast the outcome of a specific diet with significant accuracy. We did some other things as well. We are now more than sure to diagnose Parkinson's disease. We know how the therapy mechanisms work in an ionizing radiation, and also we could also tune the drug dose in melanoma cases, especially in Parkinson's. Our method, which is published, found that the relevant biomarkers to diagnose with 100% accuracy the Parkinson's are very, very small in number. Our solution, our platform, is already in use by 200 institutes, companies, and scientists around the world. But what these biomarkers are? These are, imagine when complex system like our body or something relevant fails, it's that key components of it fail. So this is exactly what biomarkers are. And the discovery of those is not an easy task. You can imagine simple clinical biomarkers like fever or heartbeat, but when it comes to what happens in cell, what kind of mutations are there, it involves, the discovery involves a lot of data. But data are hard to drill down and require the specific tools. This process is a complex one, coming from data from different experiments. They have to be cleaned, they have to be presented, and extract the relevant biomarkers, and further screen them in order to find the most important for the specific disease. Some platforms out there have developed their strategy only to do the pre-processing of the metadata analysis. InSyBio is the first one to extract, prioritize, and integrate the whole process in one. It is a cloud platform, proprietary, using a lot of machine learning algorithms, and utilizes also knowledge that exists in public databases in order to complete the framework required for this analysis. This solution is faster for already tested procedures in the market and cheaper. What's more important, however, is that it produces better results, biomarkers that are best candidates, but also relevant for the disease. We have our IP position in process. We have already one patent pending, 3 more in the pipeline, on one together with Nestlé as an open project for the proteomics community. Our business model is twofold. Premium services through projects that start with a proof of concept, and this goes to big pharma, food and nutrition R&D departments who are very heavily involved in R&D, and also B2B, but for trivial jobs and biolabs who do relevant repetitive tasks. And this is how we tend to grow, by growing both those segments. The market is big. We target oncology biomarkers, neurodegenerative diseases biomarkers, and nutritional. And through our partners, we do have access to a big chunk of these markets. We intend to build the reputation first on projects, because this is a highly technological and scientific tool. Companies are using this to expedite the process, and then we go into licensing our technology for small and trivial jobs. The team is an excellent one, strong engineering background, covers all the positions of a large and very efficient basketball team. We're 5. We're a scientific committee, and we already have completed our seed round through NBG Business Seeds. This was a very excellent opportunity for us to increase our knowledge, our productivity, our visibility, and also adjust our business model further, which was very beneficial for us. And this assisted us a lot into going global. Apart from the small number of clients we had when we started, now we are in discussion for projects in both sides of the Atlantic, and we do have alliances and partnerships with many companies, academia, and biolabs around the world. We need 1.5 million to go further and to complete the platform in 2 tranches and get, hopefully, not only break even, but an exit for an investor in 3 years from now. Thank you very much, and I'm looking forward to your questions.
You talked about special projects. Are those custom, where you're doing something very special?
Special projects begin with a proof of concept that stems from a specific need from the company. Like a pharmaceutical company have a specific problem to address. Like I do have patients suffering from Parkinson's disease. I don't know how fast the progress of their disease would be. That's an abstract definition of the project, but this goes into having the data that this situation produces, analyze the data, and coming up with the relevant biomarkers, which shows what happens to each one of the individuals. So this is a predictive analytics tool for specific biological data.
My question to you is twofold. Recently I visited Illumina in California, and within a year's time we'll have gene sequencing being able to be done at any place for $1,000 for every one. Are you an add-on technology to that infrastructure, or are you just a standalone?
There are overlaps into these technologies. Illumina is one of our major competitors, to say. But how? Illumina focuses in the first stages of analyzing the data. The data analysis is a set of sequences. It's a series of analysis steps. So some of the platforms specialize only on the first or the second stage, like pre-processing analysis or depiction of this in networks or analysis of metadata. What we did is to integrate this whole process into one. So partially, you could consider this competition map is true, but each of those specializes in different areas and different life science areas. So yes, they are partially competitors.
Okay.
So a couple of things. Are we talking about predictive biomarkers? Are we talking about prognostic biomarkers? Yes, but predictive, prognostic, or... And the other thing is, do you have any clinical validation of the biomarkers or anything planned?
Clinical validation, we work with the Medical School of Athens and also of Patras, that they have the data, the clinical data, and we analyze that. So the validations come through the analysis of specific data sets coming from their research. So yes, what we do and what we publish as a paper is the prediction of what happens in the particular case and specific biomarkers or cases that will help them in their research. So it's a mix of how you use the data, who has the data in their own ownership, and what specific problem you address in order to come to a conclusion. There are so many problems being addressed by each of the researchers around.
Your partnership with Nestlé, up to which constant is?
What kind of partnership is that?
Yes.
We started very reluctantly from their side because they
From the very first day, or?
For the very, yes, the first date to examine what will happen in predicting what's the best diet for a set of subjects they had. So as we progressed and the results came up, we reversed the whole strategy of analysis, their research methodology. We expedited actually their research for 2 years, and that partnership now comes into a lot of projects going to our joint effort, projects that they are doing together with all the institutes. They are not more one institute, but there are 4 institutes there. So instead of one project, this has cultivated many research projects together. Thank you very much.